I'll get that for you.
Great. Look, listen, before you do that, would you just check the local with me, and then I'll prep the skin?
Sure.
Look, I've asked Dr. Campbell twice today to call me. Will you pass him a message, please?
Yeah?
Now, you will feel just a little bit of pressure here. There we are. Wonderful. That's great. Anything important?
I'm not sure, really. I've taken a message.
There you go. Right, so who was it?
Someone from admin. They want you to give it a ring back.
That's the third time today. Right, I'm ready for the chemo now. Simon, I'm sorry, would you mind going and picking it up from the fridge? I think we've lost staff nurse completely now.
It certainly seems like it. I think there's a problem on the ward. I'll find out what's happening.
Thanks very much. Is everything all right, Mrs. Hughes? Won't be much longer now.
Here we are. I'm afraid Abby's going to be a while yet. I've just seen her rushing around.
Look, we can't afford to waste any more time. You'll just have to check it with me. Is that okay?
Okay. Fine. Jane Hughes.
Yeah.
Hospital number 326-7980. DOB 261274.
Yeah.
Expiry date 080903.
Everything okay? Simon, Dr. Campbell?
Yeah, everything's fine.
Fine.
I understand you've got a bit of a problem on the ward.
Yes, I'm sorry. Staff nurse shouldn't be too much longer.
Actually, we're nearly finished here now. Tell me, has my next IT patient arrived yet?
Yeah, he's in the waiting room. I have explained we're running late. Can you check his blood results? They're not looking
Okay,
good.
thanks. All right. Ignore it. Just ignore it.
You will thank Dr. Livingston for me, won't you? It's such a help you fitting me in like this.
Of course I will. It's not a problem.
Thanks.
Is that okay?
Okay, fine.
Right.
Vincristine. 2 milligrams in 2 mils.
Right. Okay, that's it. Got a plaster? Excellent. Okay. Brilliant.
Sorry to hold you up. You can't have finished already.
Yeah, we have, yeah.
I've got the methotrexate. So what have you given her? Oh my God.
Can someone call Dr. Monroe, please?
The film you've just seen provides a shocking example of how a series of errors can lead to catastrophic harm to a patient. The first question you might like to ask is, who was responsible for this tragic outcome? The most obvious answer may be Dr. Campbell. He mistakenly injected vincristine into the patient's spine. However, I want you to consider a far more critical question. Why did Dr. Campbell find himself in such a position, sitting in front of a patient with an open spinal needle in their back, having been handed the incorrect and potentially lethal drug? In reality, Dr. Campbell's error was the final act in a chain of events, each of which, had it been identified at the time, may well have prevented this tragic outcome. It's therefore important to carefully review cases such as this. As much as possible, we need to do this without blaming the individuals involved. That's not to say that individuals should not be held accountable for their actions. However, although apportioning blame may be emotionally satisfying, it's likely to drive problems underground and impede an honest and far-reaching understanding of the risks. We need to address these risks to ensure the safe care of future patients. Let's return to the film and identify some of the factors that played a part in this error.
In most healthcare settings worldwide, there are strict frameworks in place regulating the use of chemotherapy drugs like vincristine. These include prohibitions against storing such drugs in a fridge with other medicines and giving them in conjunction with other therapies. In many countries, there are also regulations specifying that a registered chemotherapy nurse must be present during the procedure and that the treatment must be given in a special room or bay. These types of frameworks and regulations are known as standard operating procedures or guidelines. These standard operating procedures and guidelines apply widely and are not specific to the use of drugs like vincristine. For example, well known are the Advanced Trauma Life Support Guidelines from the American College of Surgeons and the World Health Organization's Pain Ladder for safe and effective administration of opiate analgesia. In the film we have just seen, you should clearly note that the standard operating procedures and guidelines were not adhered to.
Yes, it's about Mrs. Jane Hughes.
I've seen this prescription for...
methotrexate you sent down?
You've already got her down for her IV this morning.
And I've only sent her vincristine up.
The methotrexate should not have been dispensed on the same day as vincristine. A mix-up of these two drugs could lead to fatal consequences, and a protocol was in place to prevent this. Had it been adhered to, the error may have been avoided.
Okay then, look, I'll prepare it for this afternoon.
Factors that may have led to the pharmacist breaking the protocol are many and varied. They include the pressure of work and a hierarchical management structure which does not encourage constructive questioning of the doctor in charge.
I've gone to pick up the chemotherapy for Mrs. Jane Hughes, intrathecal methotrexate.
Dr. Campbell should not have been allowed to administer chemotherapy.
I don't seem to have you down.
He was not confirmed as having the skills to do this. Despite this, the nurse was persuaded to allow him to practice on the ward, and the pharmacist allowed him to pick up the prescription. A system was in place, but not adhered to.
Here we are, Doctor. Methotrexate, 2 milligrams in 2 minutes.
Sadly, in many areas of healthcare, when these procedures are in place, their purpose is often misunderstood, and they may even be treated with contempt. Lack of organisational leadership, poor communication, high workloads, and inadequate education and training all contribute to the lack of adherence. Actually, standard operating procedures and guidelines can be a great protection against error. Their objective is to make patients and practitioners as safe as possible each and every time that a procedure or action is undertaken. Standard operating procedures do not destroy clinical autonomy or decision-making. Rather, they provide an evidence-based, agreed framework for protecting patients against error. Wherever possible, they standardise the procedures in place so that everyone understands their role and what is expected of them. Where standard operating procedures and guidelines are present, they must be adhered to. Where they are not in place, appropriate measures should be taken to establish them. We need to make sure we have an organisation-wide view of standard operating procedures and guidelines, so these essential components of safe care do not fall by the wayside. We need to see such procedures as the hallmark of professionalism and good patient care, rather than as an enemy. When standard operating procedures and guidelines are present, we need strong and visible leadership to ensure they are adhered to.
We can only really be sure that we're delivering safe care for patients if all the healthcare workers involved have received the right training and are up to date. A healthcare professional who has not received the appropriate training or guidance may feel under a lot of pressure to just do the job. There can be a lot of pressure to cope with the workload by operating outside their competence, especially for junior staff. Such staff may not be well placed to judge their own level of competence. They may be over or underconfident because of their limited experience. This is a potentially dangerous situation where errors can easily occur. In the film, it was obvious that nobody had a clear understanding of the level of training or experience that the newly appointed Dr. Campbell had.
Oh, Dr. Livingston, before you go, I just wanted to be clear about the amount of clinical work Dr. Campbell will actually be doing.
How much have we got? He'll take on virtually anything I would. If he's unsure about anything, then I'm always here to help.
So he's familiar with the IT rules?
Well, I would certainly expect so. He's very senior, Anne. He can do just about anything I can.
But Fiona, he's not on the IT register yet, is he?
No, but I'm seeing Dr. Munro about that later and we'll sort it out then.
Sister Lynch, in fact, queried this several times with his colleague, Dr. Livingstone. Despite this lack of clarity, Dr. Campbell was left in charge once Dr. Livingstone left the ward.
Sister Roberts, I'm Dr. Campbell, covering for Dr. Livingston today.
A culture where healthcare workers help each other, especially when staff are stretched, may inadvertently increase the risk to patients. Often, many staff may not easily recognise the boundaries of their own expertise and experience. Poorly trained healthcare workers can be a major contributing factor, leading to adverse events. Many countries are good at ensuring a certain standard as part of undergraduate training. However, in many cases, the last assessment a healthcare professional faces is at their university or college. Assessments are not just about ensuring a certain and sustainable level of skill, knowledge or competence. They're also a reflection of a wider culture of safe and effective practice. Education and training are critical components in the quest to improve patient safety. At the very least, all healthcare workers must understand the key concepts of patient safety. For those already in practice, programs must be developed to give them the skill to continue to practice safely. Most of all, healthcare professionals should know and understand safety procedures in their own local service context. In other high-risk industries, careful attention is paid to ensuring the ongoing competence of frontline staff. For example, a typical airline pilot would probably have something like 100 assessments of their competency over the course of their career. In some countries, doctors have none.
Clear communication and effective team working between different healthcare workers from different professional groups is essential for delivering safe care for patients. In many countries, healthcare is becoming more and more specialised, and clear communication within the multidisciplinary team is vital to ensure there is clarity of roles and responsibilities, procedures and outcomes. Time and time again, research has shown that ineffective communication and poor team working has been a major cause of an adverse event and heightens the risks to patients.
It's Campbell, Duncan Campbell. I mean, it should be there. There's no question it should be there. I'm sorry, I'm just a bit pushed for time, that's all. Definitely running late now, that's it. Sister, has Mrs. Hughes arrived yet?
Yes, she is. Just settling in now.
Great. Look, would you check this methotrexate with me, please?
Sure.
Thanks a lot. Can I borrow your pen?
Okay.
I've left mine in pharmacy. There we go. Thanks a lot. Look, would you put this in the fridge for me while I go and deal with this? Thanks a lot.
In the film, it should be obvious that these two terse exchanges and communication breakdowns contributed to the error. It is not just verbal communication that can be at the heart of serious error. These professionals are not working effectively as part of a multi-professional team. They're not respecting each other's roles and responsibilities and supporting each other in delivering a common goal, the safe and effective care of their patients. As you can see, without verbal handover, the written note had no context. In the midst of a complex and stressful situation, important messages that should have been clearly communicated between staff were lost. The lack of effective staff handovers and lack of clarity in individual roles gives opportunities for misunderstandings to arise. Communication can be aided hugely just by stepping aside into a quiet spot, even if only briefly. Staff need to have mutual respect for each other's role and professionalism. They need to be able to respect and value constructive questioning and deal honestly with misunderstandings. A hierarchical structure and a culture where junior staff are afraid to speak up and effectively challenge or query the decision-making of senior staff can contribute to poor team working and the resulting poor communication. Environmental factors such as stress caused by understaffing and overwork also play a part. An appreciation of the cultural differences is a key skill for successful communication in our multicultural world. This is particularly important in healthcare, especially when workers and patients may be from different cultural or socio-economic backgrounds, making some of the sensitive aspects of health difficult to address. Differences in language, customs and conventions, and even religion all have the potential to lead to poor communication and misunderstandings. Some organisations still have a culture where respectful dialogue and inquiry is not encouraged. We need to move away from this to a culture which requires open and honest communication between all players in the healthcare setting. Handover and clear documentation need to be actively encouraged and promoted. Effective teamwork needs to be encouraged.
Correct labelling, storage and dispensing of medicines is vital to protect the patient against potentially lethal harm. Medication errors in some studies have accounted for up to 30% of medical errors. Safety of medication delivery is thus one of the most pressing issues of the patient safety agenda. In the film, almost everything that could have gone wrong with Jane's medication delivery did go wrong. This chain of events started long before she was administered the wrong drug. Standard operating procedures and guidelines to prevent vincristine being stored with the methotrexate should have been adhered to.
You must be Dr. Robinson. Thanks very much.
Dr. Robinson and Dr. Campbell had never met before. They did not have specific training to be checking these drugs. It should have been the certified nurse that was involved at this level. Traditionally, healthcare workers have worried mainly about the issues of adverse drug reactions, where the patient has been given the right drug but suffers from a side effect. A separate area which concerns itself with ensuring the right standard operating procedures and guidelines are being followed and the right dispensing and delivery systems are being used is known as medication safety practice. This is an important area which examines healthcare systems to try to prevent errors such as that in the film. We all know how bad a doctor's handwriting can be. Yet sometimes the medical notes are the only way that healthcare professionals have to communicate with each other. Therefore, medical records need to be clear and unambiguous. They need to provide an accurate way of conveying important actionable information. It is essential that all hospitals, clinics and treatment centres have established policies for ensuring medication safety. In general, whether we are dealing with vincristine or not, there are certain principles that you may want to consider. For example, all drugs must be clearly labelled and labels must be easily visible. Drugs must be properly checked by the designated person against the patient's medical records and the drug chart. And for high-risk treatments like chemotherapy, drugs must only be given by nurses and doctors with specialised registered training.
Of all parties in a healthcare setting, patients often have the least input into their care. Yet, much research indicates that patients can not only enhance the quality of their care, but can prevent errors. When arriving at the hospital, Jane was stressed because of a long car journey through gridlock traffic, and probably also because of the trauma of living with cancer and facing more unpleasant procedures. Nevertheless, she was put at ease by the nurse, who asked her how she was feeling and inquired about her family. So far, so good. However, once Jane had been escorted to the treatment bay, she was no longer treated as an individual. The multidisciplinary team failed to acknowledge her as someone who could provide valuable input into her own care. She was not even asked what she had come for. Could she have had a card by which her treatment was checked with her as well? Would that have provided an additional safety barrier? Jane might have been able to spot that the team was proceeding with the intrathecal drug injection before she had been given her intravenous treatment. Had she been able to point that out, what followed might not have happened. It was the hospital's responsibility to ensure that Jane's care was safe, but involving Jane actively in her care may have prevented the terrible outcome. A patient who is familiar with the procedure is a vital resource for any healthcare worker to draw on. They may be able to spot discrepancies in the treatment plan and any deviations from standard operating procedures, discrepancies in communication or odd drug labelling. Patients are often far more insightful than we give them credit. Adopting a more patient-centred approach, trying to look at the situation from the patient's point of view, will make patients feel more relaxed, more comfortable, and lead to more effective consultation and diagnosis. It enhances quality and promotes safety. It may also save time and money.
The World Alliance for Patient Safety believes that we need to understand the nature of these contributing factors. We must learn from the errors and harm we unintentionally cause to patients in order to reduce the risks for future patients. We need to act on this learning and make improvements throughout our healthcare systems. Commitment from governments, hospital management and clinical leaders is vital to achieve this. We must also work collaboratively with patients.